privileged po to introduce to you the panel called the Chairman's Panel. This is probably the first time ever sa Pilipinas that three chairmen from Luzon, Visayas, and Mindanao come together to discuss a topic called residency. Or basically, ano pong gagawin natin after school? After we have graduated from internship, and how do we move forward from that? How do we make our decisions? How do we choose our specialties? What are residency directors looking for? Bakit po may mga taong palipat-lipat po? Bakit po maraming nagki-quit? Bakit po maraming hindi po makapagdesisyon kung saan po sila pupunta? And then we will also ask them questions about magkano ho ba talaga? Followed by what is the call schedule and why is it like that? Followed by pwede ho bang magbakasyon pag mag-surgery? And Dr. Simbulan, please be ready because we are going to ask, can women become as good surgeons as men? Ayan po. So these are the issues that we're going to be discussing today. First time ho ata talaga sa Pilipinas na pinag-uusapan po ang medical education. Most of the time we just talk about how to treat patients. But let's talk about how to treat our younger doctors. I would like to introduce our moderator po. She is a DOLE accredited occupational health practitioner. She's a Master's of Science. She is recently graduated lang po from her master's degree. She is also the municipal health officer po of the municipality of Masantol, Pampanga. She's a well-known lecturer nationally, former secretary po of the PCOM national level. She is Dr. Jean Tiangha Gonzalez. Thank you, Dr. Jean, for joining us and agreeing to be our moderator today.
Hello. Hi, Anna. Good afternoon. Good afternoon, guys.
And then I'll just call in the others for a photo ops. Ayan. And then ikaw na mag-formal introduction. Okay? We're joined by Dr. Mafi Taizon, Dr. Maria Fe Taizon, the Director of Medical Education of one of our sponsors, that is the Medical City. Siya po ang mag-decide kung kayo po ay tatanggapin ng Medical City. Hi, Dr. Mafi.
Hi, Dr. Mafi.
Hello, everyone. Hello po, ma'am. Hello, Anna.
Hi. Hawa kayo sa mga residents, tanggapin niyo sila, Doktora.
We will.
Okay, good. So, Dr. Amafi is Luzon. Ano po?
Yes.
And, we are joined po by Dr. Albert Rafanan, the Chairman of Internal Medicine of Chonghua Medical Center. I just talked to Dr. June Lasco. Formal introduction to Dr.
Si Doc Albert.
Doc Albert, maawa kayo sa mga interviewin niyo bukas. Papasukin niyo sila sa Chonghua.
Of course.
And Dr. Albert is Visayas. Ano po? And lastly, we are joined, first time talaga that we are joined by a surgeon, and napakalaking honor po talaga ito. He is a former president po of the Philippine College of Surgeons, one of the most distinguished surgeons in the Philippines. And malakas din po ang loob ni Sir to join a panel kasi most people accuse surgeons of bullying. Sir, pinuntahan ko na. We are honored to be joined by the Department of Surgery Chairman of the Northern Mindanao General Hospital, no other than Dr. Max Simbulan. Thank you, Dr. Max.
Good afternoon, everybody.
Yan.
Yung photo ho muna tayo. Ayan, ngumiti po lahat. Yung mga may tanong po sa surgery, internal medicine. Ayan, okay. So I will ilagay nyo na po. Ako po ang magmamonitor ng mga questions. Okay? So Dr. Jean, the floor is yours. Salamat po.
Thank you, Anna. Okay. So we'll start with the case, ha? I'll read the case, and then I'll ask you one by one kung ano yung opinion niyo about this, ha? So the case is, Dear Docs, I'm batch 2018 and took boards last year. I am undecided about residency. Actually, I feel lost. I'm into moonlighting, and can you give me some advice on how to decide whether I should go to residency? So maybe we'll start with the lady, Dr. Maki. Can you give some comments regarding this case?
Hi, Doctora. Hello, everyone. And thank you for having me here. So, your question is first is I think you wanted to know if you will go into residency and what will be the factors that you have to consider if you're going to residency so that you will decide on where to go and what subspecialty or specialty to take. First is I'll talk from my experience. Okay, so first is you look into the area where you're going to practice, and then look into your municipality and look into the patients you plan to serve. So you have to see what is the need in the community because we all have to look into our profession as also our mission in life. So after that is when you then you can narrow down your choices into what are your interests, no? What is your passion? So they have to come together and complement each other because whatever your passion is, and if that is also the need of the municipality that you're going to serve, then definitely the more that you can provide quality service to them, to the people. So after that, you find a hospital with the same values that you have. For example, here in Medical City, our brand of graduate, so that it's easy for us to remember, we created an acronym. We said special. So it has to be, our graduates would be special. One is a servant leader and a patient partner. So that's S and P, and an excellent clinician, a catalyst and mobilizer. I is an innovative scientist. A, an active mentor, and L is the one who loves life to the fullest. So you take a look at your own values and your own principles in life and see if it'll jive with the hospital that you wanted to join, because or if you think that you wanted to imbibe those kind of values and then you join them. uh, for example, in Medical City, it's not, we don't stop at being excellent clinician because we have to really um, like train you also to be leaders in your respective field, and also to be mentors, and also to be a catalyst and mobilizer around your area, around the municipality that you're going to serve. So that's it. First is I think you have to go into residency if you wanted to pursue further training. Look into the municipality you're going to serve and what is your passion in life. They have to jive. And then third is look into and research on the hospitals and see what they have to offer. And if your own values, as I've said, or you wanted to learn these values, and then you join the hospital. I think that's it, Doctora. Thank you.
Thank you very much, Doc Maki. At least, alam niyo, meron palang acronym yan, ha?
Yes, Doctor. Para madaling tandaan.
Oh, no, maganda, no?
Yeah.
Now, let's hear naman from Doc Albert. What can you say about the case, Doc?
I think Eric Segal in the book The Doctors, he said that one of the problems with medicine is that it's not the smartest, but the one who perseveres who actually will last. No? So this is the same thing with medicine. It's a long, long road, and I think we know that. We have to do pre-med, medicine, internship, and then sayang if you stop. Okay, so you'll only be as good as your last step of what you decide to do. So if you're gonna end up by just moonlighting, then sayang. It's still a long way to go. You just graduated from medicine. You spent so many years studying, but you're not a doctor until you finish your residency, your fellowship, and all the other trainings. I would suggest that you find in your heart, you pray. I think you did your residency, your internship, and figure out what would be best for you, and then pick a specialty where you will be happy, where you're most fit. So one of the things that usually is asked is, would you want to go to the cutting services or to the cognitive specialties? So cognitive specialties will be medicine, pediatrics, path, or the non-cutting services. So which one will fit you best? Then after you decided, then you pick, and then you continue your persevere as As it's mentioned as well, that when you look for the training program that will fit you, I would suggest that you look for the best training program you can train in. You want to become the best in whatever field you want to be, and you have, after your training, you have to look for other special subspecialty training to get you even better. Because after you do all your training, that's the time you would to start practicing and then fulfill your dreams. And you probably need to sacrifice a little bit more, and I would look for a program that will care for their residents, who will not only look into their education, but as well, there are several components in life: the mind, the heart, and the soul. So somebody who will take a look at all of your, help you grow as a physician, and who will mentor you into whoever you will become. Thank you.
Thank you. Thank you very much, Dr. Rocky. Doc Albert. Doc, that's one thing na napansin ko, no? You mentioned something about fulfilling your dreams, no? When you choose your residency training, your path, you have to look at your dreams, no? So that you will achieve it. At saka you're into maximizing the potentials. Just don't settle for moonlighting, but improve yourself some more. No? Okay. So, let's hear naman from Doc Max. Dr.
Thank you.
Max?
Thank
What?
you, Dr. Jean. Thank you
Apa?
for having me here, no. So let me start, no, with what Dr. Rapanan said, no. Fulfill your dreams, but meron pa yung kadugtong, no. Follow your destiny.
Wow.
So sometimes kasi we fulfill our dreams, but it might not be our destiny. So anyway, okay. So let me put it this way, no. Let's put it in a larger context kasi ito parang parang career path ito ng mga bata. Doktor na sila lahat, no? Nakapagtapos na, doktor na, lisensyado na, hindi lang alam kung saan pupunta. Okay. Pasensya na kayo, medyo iba yung pagsasalita ko ngayon, medyo salita ito ng matanda na, no? So anyway, ganito kasi, gone are the days, no, na pag sinabi mo na super specialist ka, ikaw na yung pinakasikat, no? Hindi na ganoon ng ngayon eh, hindi na ngayon ng perspective, no, ng career natin, no. Number one, no, let's go back to our country, no. To our country muna tayo, no. Ang country natin, Pilipinas, kulang na kulang talaga ng doktor kahit na anong specialty. And then the sad fact is that most of our doctors, specialists at that, are located and settled in the urban areas. So more than 60% of our specialists are in the urban areas. So kaya yung ating medical manpower in the country is still very 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 insufficient to cater the needs of the country, no? So ngayon, no, in terms of medical manpower, no, ang kasi ideal kasi is 1:20,000 per population, no. Ngayon hindi nakukuha yan, no, sa mga general surgeons lang, general internists, no, and general pedia, general OB, and general specialties, no. Kulang na kulang, no. And then ang direction kasi ng ating health, no, ang ng healthcare system natin sa okay. So, ang future talaga ng practice anywhere in the world is primary healthcare, because most of our diseases are tawag to lifestyle caused by lifestyle, no. So it can be preventable, okay. Sinasabi nung iba, pangit ngayon mag-general practice, no, because a general specialist kasi kailangan mag-super specialist ka. That is not the case, no. Maybe in the next 10 years, no, the general specialty will go back to its helm. Of course, there is still a place for the super specialist and the subspecialist. Kasi mangyayari kasi sa atin sa setup ng ating healthcare system sa Pilipinas, magkakaroon ng primary care, no, yun yung bulk ng practice talaga anywhere in the world, like especially, okay. So ang mangyayari nga, ang plano nga ng DOH ngayon together with TRC and some other specialty societies, no, that general specialty, no, ang training ng general specialty will already be in the provincial areas. Kasi ganun din ang UK, no, kasi mukhang pinapattern natin ng konti siya sa UK, no, ang general specialty doon talaga sa mga kahit na mga district hospitals, no, anywhere in the UK, meron silang training program doon. And then nagsa-subspecialty sila doon sa mga tertiary level na. Kasi yun na nga ang magiging pwesto ng ating medical care system. Primary care doon sa mga primary clinic, no, which is maganda. Ang Ayala nga nagsisimula ng gumawa ng mga primary care clinics, no. And then secondary care, yun sa mga probinsya, yung mga general specialty. And then ang tertiary care, magko-concentrate na yun sa mga difficult cases and research. Yun yung magiging direction natin. Yun yung ginagawa na ngayon sa Europe, yun na rin ang ginagawa sa States. Doon ang direction yun. Actually, nauna sa States yung system na yun. Ano? And the specialists, now, mag-a-apply na ngayon yung mga sinabi ni Doktora Mayfi and Doktora Rapana, no, na yung mga ano yung mga gusto ninyo, yung mga guiding principles, which is passion and commitment. Kasi pag passion lang, kulang yon, dapat may commitment ka. Kasi pag hindi mo pinanindigan yung passion na yon, walang kwenta yon. Wala ring mararating yun. Kaya nga sabi ko, you may fulfill your dreams but you do not follow your destiny. So, wala yon, no? So, hindi ko na ipopromote yung surgery, no? Kasi sasagot na lang ako kung mayroong gustong maging surgeon. Thank you.
So, well said. Thank you very much. Now, meron tayong idea na kung saan papunta yung healthcare system natin. Ano? I agree with you, Doc, na yung primary care talaga ang dapat. And I've seen, kasi I do public health also. So nakikita ko talaga yung pooling ng specialists, mga doctors sa urban areas. So hindi ganun ka well distributed. Sayang lang yung sabi ni Bisaya, yung program na hindi natuloy dahil because of the COVID. Because of the COVID thing. Now, Anna, do you have any questions from the participants? Meron po ba tayong mga questions? Nasa chat group? Hello, Ana? Okay. Ganon talaga sa Pilipinas. Medyo mahina ng kaunti ang internet connection. Ayan na. Okay. So, is it true? There's no vacation for residents. Hindi po ba that's necessary for mental health? Okay. So, we'll start again with gusto nyo, umpisan muna natin sa baba. Pakyat tayo. Okay, ano muna, kay Doc Max muna tayo, pakyat. Sige.
Okay.
Sige, Doc.
So, I can talk, no, because I am connected both with a government institution and a private institution, no. In Cagayan de Oro, actually in Northern Mindanao, there are three training programs for surgery, no. One is the Mindanao Consortium for Surgical Training, another one is the Northern Mindanao Medical Center, and another one is Amay Pakpak Medical Center in Marawi, no. And more or less these three institutions nag-interconnect kami with each other, no. So anyway, sa government there is a mandatory 5 days, no? 5 days off talaga yan, mandatory na talaga magbabakasyon ka, no? And then for dito sa Mindanao, I cannot speak for Amay Pakpak, no, but for Mindanao Consortium medical for surgical training, we have also a vacation for our residents, no. And then pag medyo iba na kasi ngayon ng profile, no, ng mga millennials, no. Pag nakikita namin yung bata medyo na-overwhelm na doon sa training, no? So, pinagbabakasyon talaga namin. Pero yung 5 days is talaga yon. 5 days is really mandatory na mag-out sila, no, sa hospital. And then they're really entitled kasi labor law yan eh. They're entitled to a vacation. They're entitled.
Okay. So that's it, Doc. Okay. So we go now to Doc Albert. Sa inyo
Hi.
naman po.
I'm currently the chairman sa Chonghua Hospital sa Cebu City. We really look into the mental health of physicians and residents because it's hard work. No? In our
Mhm.
hospital, for first years, we give 1 week off. For second years, 2 weeks off. For third years, 2 weeks off. For the fellowship program, every year they also get 2 weeks off. So we do give them breaks, and then during holidays and weekends are also off. Half day yung holidays and weekends. So we do give it's not true, we do give weeks, vacation days off. Thank you.
Ah, okay. So, Doc Maffy, thank you, Doc Albert. Doc Maffy,
Hi. In medical city, we give vacation leave for 2 weeks, and then there's another 2 weeks for sick leave if you're sick. And but however, we don't look at this vacation leave as enough to support the mental health of our trainees, including both residents and fellows. Since about more than 2 years ago or 2 years ago, we started our mentoring and coaching program. What is this mentoring and coaching program? So we trained our consultants to be mentors, like for example, on how to conduct a small group of trainees. What we do is we group different residents coming from different departments so that they can also create a camaraderie. And then after that, there will be one mentor who is a consultant who meets them regularly. And first is it will be a venue for them to really just tell their concerns. No, so that's a venue to open up. And then we discuss several topics with them, and it's an interactive thing. And for example, like how do you show empathy in times of adversity? How do you preserve your trainees' well-being? So these are just some. So it's regular. It's every month, and we focus on the first year and second years because these are the kids who really need guidance at first. And then during their senior years, we are going to start now our leadership program because, as I've said, we wanted this residents and and fellows to be leaders on their own way, health advocates when they go out to their own provinces, to the different parts of the country. So that's the main reason why we created this mentoring and coaching program and the leadership program. But they do have the 2 weeks vacation leave plus the 2 weeks sick leave.
okay. And all of the residents are still going on 24 hours duty. Tama po?
Yes, they
Yeah.
do. They do have, and then the next day they will be off. Ganun po, Dr.
How about for
We
the two
also have sick
gentlemen?
leaves, by the way. So I think all the hospitals have sick leaves, man.
For the two gentlemen, ano po, doctors, yung 24 hours na duty, ginagawa pa din ninyo hanggang ngayon? Kasi that's why I'm asking. It's because merong mga proposals that the physicians, no, residency training should be around 12 hours duty lang daw on shifts. So what is your opinion about that? Doc Albert muna. Yeah, sige, Doc Maffy, yes. You
Doctor,
raised
the 12-hour, we do that in highly strong units, for example, at the ER and the ICU. It has to
ah,
be like only just 12 hours. Kasi we noticed that their performance was really affected if you make them go on duty for 24 hours in these areas. So here, mandatory 12 hours po talaga.
okay. How about Doc Albert? Oo.
Ideally, residents should not go on call more than 24 hours. That's what we know. In the United States, they're pushing for that. We're gonna
Yeah.
need a cultural change here in the Philippines to push for that. Actually, we're trying to do that now. I mean, cultural change. What I mean, so all institutions will. In the U.S., it's once every 4. Here, it's once every 3 duties. So, But we do try to make some changes to try to make things more livable. Uh, I guess help the residents go through. But I agree. Ideally, we should probably not go for 24 hours duty. Unfortunately, at the current situation right now, we're not able to do that. But we do make sure that residents do find sleep, and we make sure that they're not overworked and they have help with them. So help is always the asking. Help is always available for the asking between first year, second year, and third years. And so far, we're able to say that we have no quit rates here in Chongwa despite the COVID.
Yeah. Okay.
Thank you.
Oh, yeah. Thank you very much. How about Dr. Max?
Yeah,
How about the 12 hours duty?
actually,
Interrupting you.
pinag-usapan na natin namin yan, no, with PRC and the specialty societies, no, regarding the work hours of the residents, no. Kasi ang talagang requirement talaga is 40 hours a week, no, 40 hours a week na mapufulfill ng mga bata, no. Kaya lang kasi realistically hindi naman talaga nasusunod 'yan, no, kasi depende sa ospital na pinag-titraningan mo. Pag nag-training ka sa government hospital, talagang hindi hindi realistic 'yan, no. Kahit na Sabado Linggo, you still have to go on duty, no. But kami naman, Northern Mindanao Medical Center, we see to it naman that hindi talaga sa overwork. No, para na sinabi ni Dr. Mafi, tinitingnan namin yung mga areas na talagang high strung, no, like the ER, no. So ER hindi mo talaga kaya yung ngayon ng mga bata, hindi talaga kayang i-straight yung 24 hours. Kaya ginagawa namin every 12 hours yan sa area na yan. So sa mga medyo magagaan naman ng konti sa ward and everything, no? Yun, 24 hours. Pero ngayon, during the COVID times, medyo binago namin yon because of this contingency na nga ng infections, no? So, ginawa namin yung mga work areas ng halimbawa ER, OPD, ward, ICU, OR. So may mga duties doon, no? They go straight 1 week and then they're off for 1 week. So ganun yung ginagawa namin ngayon during the COVID time. Pero yung sa regular na, sa normal days na, pero I don't think we will have a normal days, no? New normal na talaga to, no? So it will depend on the number of residents, no? The more residents you have in that particular department, the easier, no, or the more convenient the duty hours, no, the frequency. Kasi pag kukunti kayo ay talaga every other day kayo. Pag marami, every 3, every 4, depende sa number of residents. Siyempre, sa curriculum kasi nila, despite the work hours, they have to fulfill the deliverables, no, for that particular quarter or particular semester. So they have to fulfill that regardless of the hours.
So, thank you, Doc. I'm thinking, Doc, itong COVID kasi, no, I think medyo malaki rin talaga yung impact mental health ng residents natin. Especially, I've heard of hospitals who do not allow their residents to go home, no? For the simple reason na maraming community, meron din bullying, no? When they go back to the community, merong mga iba pinapaalis sa bahay. That's why merong mga ibang residents they stay there. However, when they stay naman inside the hospital lang, nandun din naman yung parang nagdalo sila na parang may enclosure ba? Yung hindi sila, walang freedom to move around, to go out, no? So what can you say about this? Is this effective strategy to prevent yung transmission ng COVID, but at the same time, ano ba siya kamusta ba naman ang mental health effects nito sa residents natin? Okay. Who would like to go first? Parang gumaganon si Doc Mafi. Doc Mafi, yes.
Dr. I'm an infectious disease specialist. So kami yung talagang naka-frontline and ang medical city was challenge because it became known as parang puntahan ng lahat ng COVIDs during the time na yung peak ng pandemic. So what we did was create teams, initially create teams among our doctors, like para meron din silang quarantine na and rest at the same time for about 2 weeks and then go on duty again yung team. So parang ABC, ganun ang ginawa namin noon. And we really do saw the challenge ng mga mental illness, mga depression, anxiety, talagang medyo lumalabas nun. And so what we did was we really tapped our Department of Psychiatry. Merong kaming mindfulness program. And then what we did as online muna lahat and then calling on our residents and continuing this mindfulness session with them. There were even like times that we have to conduct an open forum for them. And we invited the department chair of the infection control so that they will be also enlightened why, for example, we are strictly adhering to PSMID guidelines of not swabbing everyone when all the other institutions are swabbing everyone, something like that. So we have to show them the rationale and the scientific evidence. So talagang medyo mahirap nun. When it comes to their lodging, we closed a floor for in the hospital for them, and we also had partners with us, like for example the De La Salle brothers, they opened up their school for us. No, sa mga, so it's really partnerships, and we are really, really lucky and thankful to them for helping us out. And inside those areas where they are kept, we don't keep them. It's their voluntary. If they wanted to stay, we provide them lodging. If they wanted to go home, we provide them education. They have their complete PPEs. We're able to, what we did was create a 2 hospital system so that there will be areas that are safe for other patients and also. So, kaya continuous din ang training nila. And then again, as I said earlier, we have a lodging. We offer them lodging and we provided them with the complete PPE and then the training. Yun. So, life went on, although very challenging. So, good thing then that our colleagues nga from the Department of Psychiatry were really open to helping these kids. So, nagkaroon kami ng program na ganun for them.
Okay. Thank you. Mahirap talaga di ba? Kasi
Yes,
you cannot do anything about it. Andiyan na siya no? How about Dr. Max? Do you have anything to add? Or Dr. Albert? Yes?
Nako na rin namin yan, na-anticipate na rin namin yan. Not only for our residents, but all of the healthcare workers at the hospital. But specifically for surgery, parang na sinabi ni Dr. Mafi, we also have the mentoring system. So each residence, meron siyang corresponding mentors. So we emphasize, I really emphasize to the department that you have to be more mentor now than ever, because this is the time that they need you most, lalo ng mga residents. And another thing is also that yung lead by example, kita nila na yung mga residents, yung mga consultants naman, nakatago lahat, sila lang nagtatrabaho, medyo mababawasan talaga yung moral ng mga bata, Kaya encourage ko din yung mga consultants namin, kasi sa department ginawa namin, nag-form kami ng echelon, First line sa mga consultants, first line, second line, third line, Yung third line or last line namin, yun yung mga vulnerable na mga seniors na. So talagang nilalast namin yun na tatawagin. So yung first and second echelon namin, sinasabak talaga namin, Nagtitriad sila, nag-OPD triad, and then of course, nag-opera. Dati, takot pa mag-opera ng COVID, pero ngayon, parang ordinaryo na kami nag-opera ng COVID kasi after all, mas hard than the rest of the hospital Kaya ngayon ang infection ng mga healthcare workers is not in the COVID enclosure. Yung outside of the COVID, yun ang mas nagkakaroon ng infection.
Okay. Okay, thank you, Doc Max. Doc Albert?
I'm also a pulmonary specialist, so we go into the COVID area. So we take care of the
Oo.
critical care patients. There was a time when we first started out, so we did several preparations, many protocols were done, talking to our residents, and there were so many changes. Initially, we screened the high risk residents. So there were two residents who had comorbidities, so they did not But there was a time when we had more COVID patients than TGH. There were like more than 200. We had 5 floors of COVID, one full ICU, and everybody had to pitch in. So I'm just glad that my residents continued the fight. Nobody gave up. As I said, this was a time that we show courage and bravery. We know that it's a risk to us as well as to our families. That's the greatest thing, that when we go home, we worry. They go home, they worry that they're going to infect friends. And some of my residents actually stayed in their own condos, or there's some places where in the dorm where they stayed and they won't go home. But it was a difficult time. So everybody had to talk among ourselves. Um, we did have psychiatrists, but it was more among ourselves. We had small pocket of meetings to distress and to talk about the problems. So we had reflection papers, and we reached out to everybody. And I think yung isang time na left and right na intubate, I mean, sa floors, when it was too bad, that's a problem with healthcare. When it gets overwhelmed, when everybody gets burned, I think we've been through that. It can be very difficult. No, so we've been through that, and we don't want to go through that again. Hopefully, everybody wears masks, do social distancing, and do personal hygiene, so that this will not happen again. So I'm glad that none of my residents quit. There was so many times that they wanted to go home and just stop. So but they were brave enough to continue, and I would say that for all the IM residents, all the surgical residents, everybody that has continued, somebody has to continue this fight, because if nobody sees these COVID patients, who's gonna take care of them? So we try to make them as we give them bonuses. I mean, that's only bonuses, food, lodging, everything that could possibly help at least alleviate the suffering and the pain of seeing these COVID patients. Thank you.
That's why we're really thankful that the young ones are interested in residency training now, no? So there's a question here. Please, what is the vacation schedule for a resident? Paano daw ba yung bakasyon? Like, they have 2 weeks. Paano ba yung schedule nun? Sabay-sabay ba yun? Or you wouldn't get to you know,
Pwede ako sumagot niyan.
sige, Doc Max.
Kasi nung nagtitraining pa kami, nung panahon namin, pag yun ang tanong, di ka pa nga nagtatrabaho, babakasyon ka na.
Totoo yan. Yeah. Iba kasi ang generation ngayon eh.
Kaya nga, hindi. Anyway, yun I think we discussed that already, no? We discussed that.
Yeah.
They had a vacation. Okay?
Okay. Actually, we at the Philippine College of Occupational Medicine looking also into that scheme, no, yung schedule na medyo workable naman, but at least may balance ng shift work, no? Kasi there's a tendency for the burnt out, the fatigue syndrome, no, among our residents. But because you have programs, and I've heard that you have very effective programs naman, I think okay naman eh so far. Ang nakikita ko lang dyan kasi ako, I'd say yung earlier batches, no? Parang kasi training ground din yung nahihirapan ka, di ba? Yung lagi kang nandyan, you're always alert, no? You're not that, hindi laging bakasyon. Kasi you're a physician eh. Diba? Parang ganun ang ano eh, ang thoughts na you have to be laging alert on the, the presence of mind all the time. That's why it's sort of a training schedule among doctors now. When you finish your residency, matapos ka ng training mo, talagang ano ka, ready ka sa battlefield. Okay. So, meron din naman si Ana kanina that I'd like to ask, with the permission of the others, no? Si Doc Max, about the female surgeons ba would be as good as the male surgeons?
Kung
Yes,
sabihin
Doc?
kong better. That is good. So anyway,
Magaling.
in my department, Northern Mindanao Medical Center, I have five female residents. And then dito sa consortium, sa Mindanao Consortium for for surgical training, we have four also. And throughout the country, there is already an association of the Philippine Association of Women Surgeons.
Hindi ba
And
nagliligawan
they
sir?
are top, no? And they are top, no, in their own fields, no? Sa 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 place ni Dr. Mafi, no, there is their Dr. Tawag dito, yung pediatric surgeon natin, no, si Dr. Si senior moment ako. And then sa Cebu, no, nandiyan si Dr. Du, no, mga female surgeons yan, mga sikat yan,
Female
ano.
surgeons.
Oo, maraming sikat na female surgeons, marami. Not
Matutuwa si
only
Ana niya.
the the former president the former president of the American College of Surgeons is a female surgeon.
Female pedia surgeon.
Oo. Saka yun, actually ang surgery kasi dati nga, ang surgery is a man's world, eh, no? So, nung pumasok yung mga babae, medyo siyempre, naninibago. Pero ngayon, actually, nagdo-dominate na nga sila. And not only that, no? Even the third sex, no? We already have residents, no, in the third sex. No? We are not discriminating everyone, no? So, who is the one capable of doing the job, why not? Regardless of gender. Oh.
That's nice. It's nice to hear. Okay. Do you have any more questions, Ana? From our participants? Yan. Good afternoon, doctors. How to take IDS a suspect po? How many years and where to train? Thank you, Dr. Steve. Okay. IDS.
Yes, ma'am. Ang infectious disease, you have to undergo internal medicine residency first. Yes, Dr. So after 3 years of IM residency, and then you can already go to a 2-year residency program. So 2 years. We have many residency training program. We have already here in Medical City. So we will be graduating our first two ID fellows next year. So we have 2 slots. And the other fellowship for ID includes UP, UPPGH, UST, San Lazaro, St. Luke's, CHAIRMEN. May nakalimutan pa ba ako? So far, yun, Doktora.
Madami na pala.
Pero parang kulang pa kami. So, dahil in this pandemic, lumabas talaga yung need for infectious disease. So, we really wanted to encourage our young doctors to come and join us kasi kulang na kulang ang infectious disease sa country. That's right. Apa.
How about ang mga pulmo, Doc Albert? Kulang na kulang pa din?
This time the pandemic, there was a time when we were in Pulmo, we used to go on duty. We deck all our patients. So once every other week, we were going into COVID. So 1 week on, 1 week off.
Grabe, no?
So yun yung dami doon. Then we see so many patients. There was a time I saw 40 COVID patients in one time. I think ID also sees them a lot, no?
Yes.
So sabay-sabay naman yan. So, pulmonology. So again, if you want internal medicine for 3 years, then after that, you can do a subspecialty training for pulmonary medicine for 2 years. There's a lot of subspecialty training programs in pulmonary in Manila. In Cebu, we currently have 2 institutions with pulmonary training programs as well, Chonga Hospital and Perpetual. In our institutions, we have 3 slots per year for pulmonary fellowship, aside from the other subspecialty training programs. So we'd like to encourage you to join us.
I heard, Doc Albert, that you're also a sleep specialist.
Sleep,
Oo.
yeah.
Sleep, oo.
I'm board certified in pulmonary, critical care, internal medicine, and sleep. So,
Wow.
yan, Doc. I chase my dreams. I try to be the best I can be. And then,
Baka
that's
sabi
why
nga
I'm
ni
here.
Duke Max, that is your destiny.
Yeah.
Di ba?
And I'm happy. They say success is achieving your dreams, but happiness is accepting what you get. Diba?
Wow, nice. May photo na naman ako nga, pwedeng i-post. Ang ganda. Okay, so we go now to the question again. No? How would you deal with bullying? And may process na po ba of reporting?
Okay. Can I answer? Can I start?
Yes,
One of the
Doc.
one of the things that I noticed, residency training in the Philippines and residency training in the United States was different, but now I think the Philippines is getting better. It used to be, I think we used to use a very punitive type of medicine hierarchy. We talk about ang doktor ay Diyos,
Mhm.
so what we've been trying to do is do a cultural change. So hindi naman kailangan paluin yung bata para gumaling, di ba? Yung sa US walang pinapalo talaga. So you have to educate. Education should be done in a more benign way. So there should be no bullying. When you teach, you're there to mentor, to help them grow, and not to do negative reinforcement, but positive reinforcements. And I think the Philippines is getting better naman. So it's a culture of learning. If bullying does occur in our institution, then they just have to report to the chairman or the training officer, and then we don't look into we don't cajole, we don't condone to that, and we make sure that it doesn't happen.
Thank you, Doc.
Thank you.
Yeah, do you want to add anything, Doc Max, about
Ah,
bullying? Oo.
masasabi ko lang, yung gusto mag-surgery, kung sa tingin mo you are bullied, you are not supposed to be a surgeon.
So, surgery
So
ka
yan.
na comment.
Pag nagpapabully ka, ibig sabihin hindi ka dapat surgeon, ha? Hindi, kasi
Pero
ang
I think
bullying
Doc
naman
as
is a state, eh. It is a state,
pero
no? Kasi merong ganito naman talaga yung certain parang standards of practice sa isang area. Sa iyo, sa tingin mo, bullying na yon, pero actually, it is a common practice there, no? Pero anyway, sa standards naman ng training, meron naman talagang sinasabi na sumosobra na yung no, yung kanang tawag dito, abuse of power na talaga, nang bubuli, mga ganun, no? So, meron
Yung
talagang ganun na
senior ang
standard, no?
cause ng bullying. Ganon. Ganon ba yun, sir?
Ano?
Yung senior resident ba ang naging source ng bullying?
Hindi, not necessarily. Meron ngang first year nang bubuli ng senior, eh. Oo, depende kasi sa personality mo yan. Kaya nga ibig ko sabihin, pag mahina-hina ka, huwag kang mag-surgeon kasi kailangan tapi-tapi ka. Oo. And for that, you will be surprised. The ladies are tougher than men nowadays. Oh, they can withstand more the pressure. Mas may man nagkikwit pang lalaki kaysa sa babae ngayon.
Talaga?
Yan. Mm.
Ba, maganda yun ba? Yeah, yes, Doc Albert, you were saying something kanina.
I think we have to change. We've been trying to. I think we have to change the way that we do medical education. So we can teach our younger colleagues by being kind. So kindness can be taught, even though we were bullied or spanked by our parents. Doesn't mean that we should spank our children, di ba? So that's a personal opinion. Thank you.
That's
In Medical City, Doctora, we
Ah,
are promoting the non-hierarchical culture, the non-hierarchical. Kaya
okay.
the residents actually, for example, can call their consultants like me. They call me Doc Mafi. They don't call me Dr. Tyson. So first would be first name basis. That would be okay. Just show respect. And for the bullying, there is a process. And during admission of residents, it's included in their orientation. That if, for example, you think that you feel uncomfortable coming from a consultant or coming from a colleague, and then this is the process with your TO, with your chief president first, and then with your TO, and then the TO to the chair, and the chair, for example, to me. If you feel uncomfortable, if you feel uncomfortable telling your TOs, and then you can go directly to the Department of Medical Education, so they know that. So they know that, and we have practiced that. We have several cases, and sometimes it just turned out really with perception. It's siguro sometimes oversensitive sila. It's really not really bullying.
Yeah,
Uh,
sometimes, yeah, good. Like,
yes.
ano, may, well,
The
siguro
times
nasa
they are
personality
changing.
rin. Yeah.
Yeah.
Yeah. Noon talagang nakakatakot eh. Ano. Okay, so we have a question here. How would you encourage residents to continue residency? Marami po nakikitang nagko-quit, no? May co-resident po has had 2 residencies, no? And then pa-third na siguro yun, yung ngayon niya. Okay. So, paano natin ma-encourage na magstay sila doon? Okay. Who wants to answer first?
Okay. I think
Doc.
before you go into residency, you have to be sure what you want. You have to understand that this is something that you need to go through to get better. Like I used to say, if you want to be a Navy SEAL, you want to be the best doctor, you want to be a Navy SEAL, then you have to go through hell or work. Okay, so you have to be in that mindset that this is not a time to get vacations, not the time to count the number of days off, but you're here to work. But of course, as training programs, we look into your welfare. So that's the first thing you need to go. That you're going to get into this because you want to be the best doctor you'll ever come out. So you work hard, and you people will help you, will train you. So that's the first thing. Second thing is some individuals may need to pick which program they want. So if they just want to become a average doctor, maybe go to a program that doesn't demand too much. So that there are other you go to a residency program that doesn't need too much work, or you pick a, like, I think, you know, if you want to really be a good surgeon, then you need to take whatever bullying there is. If that's a situation, then you can ask. If you do not want bullying, so don't go to an institution which has no bullying. So those are things that you have to look into. And so, as I said, we as training programs, as chairman, training institutions, we can only support residents. So we help them. So, but this marathon is a race. So if you're gonna give up, then it's up to you. But we are just here to support you. And sometimes residents do change their mind. But I suggest that you make up your mind and you go through this and you finish this, because at the end of the road, you'll get better and you'll be the best doctor you'll ever be. Thank you.
Yeah. Yeah. Right. Huh? Okay. Doc Max? Yeah, you want to add?
Oo. Pangit, pan ba dyan? Pangit yung reception eh. Okay lang ako, okay
Medyo
lang reception ko.
okay na po ngayon. Minsan lang siguro. Oo.
Wala, no?
Okay na po ngayon.
Oo. Kasi kanyan eh, tawag dito. Ang pagsa-surgeon kasi, talking about surgery, no? It's a vocation, no? It's a direction. It's a calling, no? Sinasabi ko nga sa kanila, sa mga bata, no? Not everybody can be a surgeon, no? So you have to have these particular traits, no? To survive, no? Being a surgeon. So una nga, no? Kung ganito kasi yan eh. You want to be nationalistic, no? Titignan mo yung needs assessment kasi. Ano ba talaga ang gusto? Anong kailangan ng country?
Kailangan.
Tapos ikaw naman, ano ba talaga ang gusto mo? So, i-match mo yung dalawa. Kasi gusto mo nga yun, ang dami-dami nyo naman yan. So, hindi ka pa rin masyadong kukadya kasi numbers kasi matter pa rin eh, no? So, if you already decided na gusto mo talaga yan, tapos tingnan mo yung mga role model na gusto mong gayahin, kung paano silang naging ganun, so more or less may idea ka na kung ano yung course mo na pupuntahan. Kasi kung pupunta ka lang talaga sa isang specialty, Parang you're just testing the waters. Mukhang hindi, that's not the wise thing to do, no? Because being in a specialty is really a vocation, it's a calling, no? It fits your personality. Ang may personality ang surgeon, may personality ang internist, may personality ang pediatrician, ang OB. Pag medyo hindi ka nag-fit in do sa personality na yon, medyo mahihirapan ka talaga. So, yun na nga, yung sinasabi kanina na grit, passion, and commitment, dapat ilagay mo talaga yun sa kukote mo. Hindi puro convenience lang, no? Kasi iba, that is your life kasi, that is your life. Your life will revolve on that, in that, no? So, you have to decide decisively, no?
Okay.
And wisely, of course.
Okay. Yes. So, I'm going to go to the next question. Ha? Kasi I think, marami yatang questions ngayon, eh, no? So, sunod-sunod tayo. I'll be just pointing kung sino yung sasagot, no po? So, how do you deal with grievances of residents? For example, conflicts between RODs, different departments, or nurses, or the ever sexual harassment, reports na ever present na ganyan. So, how do you deal with that? Doc Maki?
Yung doktor sa mga grievances ng trainees, they fall on my office here. So, kasi sa Department of Medical Education. But before that, sa level ng department, nag-undergo na sila ng investigation. There's a formal root cause analysis kung ano yung pinanggalingan ng conflict, especially kung in between departments, and especially if it involves patient care. And then, for example, it involves naman the nursing service. So, ang investigation will also be conducted jointly by my department, the medical education, and that of the nursing service office. So we usually conduct a multidisciplinary meeting, and then we look into and we focus on the processes, not really on the personalities, because usually most often than not, it will boil down to ang pinaka-common dyan sa experience namin, miscommunication eh. It's really just a matter. It's just really a matter of expressing yourself professionally and with respect to each other, and then usually minsan ang problem dyan, may loopholes sa processes. So ganon. So we really don't give immediately punishment to the nursing service or to the trainee. We look into the reason. But of course, if there is a negligence on part of the trainees, nasa manual din namin kung ano yung kaakibat, yung equivalent na shall we say punishment nila, parang something like that. Pero everything is documented. Everything has to be documented, and everything has all parties will sign on the document that they agreed upon the decision, so that it will be fair to everyone. So ganun ang the way we deal with it.
There's a question here about that's connected with that also. No? What if naman the consultant is physically hurting the resident? I don't know how hurting means, no? Na physically hurting. Ano kaya to? Sinusuntok, sinasampan, sinasabunutan, no? Aside from verbal abuse. So that's the answer this. Doc Albert?
So we also have an office of the Assistant Medical Director for Medical Education. So if a case is filed to the Assistant Medical Director for Medical Education, so we go through root cause analysis, incident reports, haba-haba, daming ginagawa. No? Figure out. Yung sa akin naman, chairman at saka TO ako, yung sinasabi ko, magkwentuhan na lang muna tayo. Diba? Kung may reklamo yung nursing, kinakausap mo na ako, kakausapin ko yung residents, magtulungan kami. So we try to, and as you mentioned, it's usually miscommunication. So we usually try to, malit lang naman yung Cebu. So kwentuhan lang muna, trying to fix things. Kung hindi talaga maayos, then it's elevated to the Assistant Medical Director for Medical Education. Kung gusto, maghanap ng lawyer, pero ang gulo niyan. Para sa akin, ang gulo. Huwag na lang
Mahaba,
sana.
no? Mahaba. Pa kasi
Mahabang
physical
proseso.
abuse na
Kwentuhan
eh.
na lang tayo.
Oo. Dapat ma-settle na. Yes, Doc Max. You were signaling. You wanted to add, Doc Max? Nawawala si Doc Max. Mahina, it's a signal problem. Yes po.
Okay.
Okay. Yes po.
Ako na magsasalita.
Opo.
Ang pangit ng signal, nawawala-wala ako eh.
Sige po.
So
Kayo na
anyway,
po.
we are still on the topic of yung RODs with nurses and everything, no?
Oo, yung physical abuse na, Doc. Hindi lang verbal, pero meron ng physical.
Baka ginamit yung scalpel.
Naku. Surgeon yun.
Hindi, yung back ng scalpel, yung surgeons, di ba? Pinapalo.
Hello? Nawawala
Pinalo
yung signal ko eh.
yung surgeon ng back ng scalpel.
Yung topic ba natin nasa kompa tayo? RODs, no?
Opo. Wala si Doc. Sige, tayo natin konti. Ayan na. Sige, Doc.
Ayan
Just,
Ano yung topic natin? Doon sa RODs pa rin, ano?
yung po
Nawawala ako eh.
yung physical abuse, Doc.
Physical abuse, Doc.
Ano yung physical na, hindi na lang verbal?
Tsaka yung physical abuse for some people is different. Nawala na naman si Doc.
Nawala na naman siya ulit. Mahina. Umuulan ba sa Cagayan de
This
Oro?
is the thing with millennials kasi physical abuse could mean kurot, di ba? Kurot is physical abuse na, di ba?
Yan. Oo. Yan.
Pag kinurot mo, Doc, physical abuse na yan, di ba?
Nung kami nagtitraining, marami yan. Nung kami pa. Pero
Kahit
ngayon,
bata pa tayo, Doc, di ba? Pinapalo tayo ng mga teacher.
pero ngayon, pag ginawa mo yan, sigurado may kaso ka. Meron
May
ka pa
kaso.
may newspaper ka pa. Kaya, yun yung sinabi ni Dr. Rapanan kanina, no, na yung environment, yung horizon ng training ngayon, environment, binabago na talaga natin yon. Kasi we really want to treat our residents as adults, no? Because after all, they're already doctors.
Yeah.
Doctors, no?
Correct.
Oo. So,
Wala na naman siya. Tumawala.
kal na yan.
Doc Maffy, I
Medyo
congratulate you for a very
isolated lang
program.
talaga yan. Isolated.
Thank you. Thanks. To you too. Maghanap ang pulmonary medicine now.
Maghihirap actually, kayong tatlo talaga. Mahirap yung ginagawa ninyo, no? Okay. I'll go to the next question na habang inaayos pa ni Doc Max yung kanyang signal, yung kanyang connection. Any comment po on specialty societies? Kasi parang requirement ko napakadami, napaka-difficult. Sobrang hirap daw maabot. Meron dito presidente,
But yung life is a choice. Life is a choice. So pwede naman, if you really want to be a subspecialist, maybe mahirap talaga. But that's a choice. So you can do a general practitioner role, which we really need as well, primary care. But if you want to be something, then you have to work hard on it, unfortunately. Diba? Ganun nga. You cannot make it easy kasi it's just difficult, I think.
Yeah.
Ikaw, Mafi, may masabi. Papadaliin mo na lang yung exam
Pero,
daw.
pero I think nowadays, especially with the COVID, most of our societies are very forgiving.
Yes.
Tama ba ako, Dr. Max? Yung sa PCS daw yung ratio noong cases is parang more lenient with the number of cases that they have to fulfill, especially with the COVID. So I think the societies naman, just remember na pinag-aaralan yan mabuti before ilabas ng specialty society yan. So, katulad ng nasabi na, syempre, kailangan paghirapan natin, no? Para maging magaling tayo. And then at the same time, everything will have its price at the end. Yun lang naman yun.
Ah, two prongs kasi yan, ano? Two prongs yan.
Yes. Yes, Doc.
Titingnan mo sa ibang countries, first world countries, once na pumasok sa training yan, program, most of them really made up to the being a diplomate, no? Sa atin, unfortunately, mukhang 40 to 60% lang ang pumapasa. Yan sa atin. So, ang tanong ngayon dyan is that, sino ba may problema? Yung bang residente na nag-training o yung training program mismo?
Yung program.
Oo. Kasi yun na nga, number one, pag pag pumasok ka sa isang specialty na gusto mo talaga, ay dapat gawin mo ano yung required of you sa curriculum mo. Kung bakit hindi ka papasa.
Oh,
Wala na naman yan. No, no, no.
oh no.
Nawala. Yan. Diba?
Di ba mahirap maging doktor? Kasi dami mong pag-aaralin din, di ba?
Exactly,
Oh.
no? So, yun na nga, maraming reason, pero ang bottom line lang kasi dyan, when you are already a member of the society, which na kailangan ngayon, pag naging member ka ng society, dapat diplomate ka, no? So, yun nga, mas maganda yun kasi pinaghirapan mo. Pero, meron naman kasi mga instances na pinaghirapan mo na nga pero hindi mo pa nakuha, no? Na nakuha yung gusto mo. So, ang tanong ngayon dyan, ikaw ba talaga ang may problema? O yung training program mo? Or yung examining arms mo? Maraming factors to consider, no? Maraming factors to consider. So, inaayos natin ngayon yan sa Pilipinas, no? Pero, be that as it may, mas maganda, pag gusto mo talaga, walang mahirap. Yung sinasabing, pag gusto, maraming paraan. Pag ayaw, maraming dahilan. Oo. So, ganun lang yun. Pag gusto mo, kaya mo yan. Pwede kang maging diplomate. Hindi na rason yung requirements na yan. Kaya mo yan.
Fight, no? This brings us to the next question kasi related siya eh. Kung kunyari, Doc, hindi naman yung resident may problema, no? Kasi nag-aaral, kaya lang, it's the training program. Ito, kagaya nito, kunyari sa COVID, no? Ganyan. Kailangan, dapat ba baguhin pa? Meron pang revisions na gagawin because we're being faced with this new normal ng COVID right now.
Okay. Actually, Doktora, no, meron kaming gagawin ngayon na conference sa DOH regarding the status of the training programs during the pandemic times. It's just unfortunate na selected lang yung attendees, no? But all the stakeholders in the training program, the specialty societies, the PRC, the examining arms, and some selected training institutions are invited in this forum, no? This is on the first week of November. So, tatanong ko lang kung pwedeng talagang malakihan siya na parang ganito na webinar na maraming makakapag-attend, no? So, I will try to pwedeng maka-accommodate ng mas marami. Kasi this is ang mga speakers dito, yung mga stakeholders ng mga training programs. Saka example.
Doc Albert, I'd like to ask yung tungkol dyan sa mga subspec. No? I think it's related to the last question. Can you flash it, Ana?
If the training program has been affected by COVID.
Oo, ano ba? Meron bang
The question is, has the COVID pandemic affected our training institutions?
Yeah.
So, I would say that in internal medicine, usually we're able to fulfill all the requirements, and there are certain cases that we see less. So what we do is we supplement it with case-based discussions and learnings from other cases, so everybody shares, so more morning reports. And now we're doing face-to-face. Dati kasi telemedicine lahat. Pero
Oo.
teaching face-to-face is different from
Ang
telemedicine
hirap
talaga.
naman ng telemedicine,
Oh,
no?
hirap. So we're doing face-to-face now, and we're doing more. And then, but the internal medicine, I think, has not been affected. I think it's more of the cutting specialties because they have to have a certain number of cases before they can graduate
Yeah.
doctors.
Mm-mm.
The clinical departments,
Mm-mm.
they were creative, no? Actually, all the departments, what they did was they became creative. What they did was partner with experts
Government.
abroad, Singapore, and then Taiwan, Taipei, and then even kasi we do have consultants who are also faculty, for example, in Mayo and Johns Hopkins. So nagpartner. So yung kanilang training while they were in their homes during that time kasi 'di ba naka-team sila, team A, team B, team C ganon. So kapag turn nila na sila yung naka-off sa bahay, yun ang ano nila, yun ang routine nila. They undergo this training program. We also have an internal platform in the hospital that is being used in training wherein they can undergo testing exams. Quiz. So, ang exams nila tinutuloy, pero syempre, must tone down kasi yung mga emotional nila. Pero para lang magkaroon sila ng sense of normalcy. Tinuloy ng mga training officers ang some of their exams. So, through the platform sa kanila. So, they were able to do that at home.
Parang
So,
ganun.
So, nagtuloy-tuloy naman. So, kaya lang talagang yung sa surgical departments namin ang talagang naapektuhan.
Nila eh. Hands-on
Yes.
sila.
Yes, Doctora. So, but now, if this will continue, we have a simulation system here na they can do virtual reality. They can, like for example, laparoscopic. So they can do virtual reality pa isa-isa.
Do them abroad.
Yes. So that's what they're doing. And
Yeah.
that's also the future for the meantime now. That it's
Yeah.
COVID, that they don't have much cases.
Safer.
Pwede
no?
naman, doktora eh. I think
Pwede, doktor na? Apa?
sa PSGS, sa General Surgery Program ninyo, pwede silang pumunta sa kung saan connected yung mga consultants nila na may pupunta sila sa ibang ospital, provided that they are diplomate and fellow sa PSGS, ma-accredit yung training, yung kaso na yun. Pwede yan. Pwede yan.
Thank you. Thank you, sir. Thank you. Yeah.
May question about the radiologist. No? Paano nila yung career ng radiologist?
Maganda yung wild chairman.
Any advice for future radiologist? Siguro ang sasatipuro mo siguro.
That's a good specialty. That's a good specialty. Good luck.
Yeah. Actually, maybe I can help. It's really a good subspecialty nowadays, especially nowadays. And then after nila mag-radiology, most of our residents go for another subspecialty because we offer fellowship, especially interventional radiology. So that's one of the in thing now because hindi sila invasive, semi-invasive. So yun ang tama ba ako, Albert, no? Yung nila, thoracentesis nila, yung mga mask nila, fine needle nila. They're all being done by radiologists. Interventional guided. Diba, sir?
Brain aneurysm.
I think,
brain aneurysm. Interventional radiology.
I think, so what I understand from the questioner is, I think everybody, when we graduate from medicine, you have to figure out where you want to go. So kung gusto mo ng bata, pediatrics. Diba? Kung ayaw mo ng bata, huwag ka mag-pediatrics. Kung gusto mo mag-opera, cutting service, baka surgery, pero you have to understand that it takes work, doc, and commitment, diba? If you want to be the doctor's doctor who takes care of all the patients, baka I am, diba? So yun. Yeah. So if you want to have a holistic type of approach, family medicine. Kung gusto mo, ayaw mo tumingin ng pasyente, pwede ka magpato, di ba? Marami namang paraan. I mean, everybody has to figure out a way which saan ka hiyang. And then you have to understand as well, pagpasok mo, iba-iba rin yung training program. May training program na mahirap talaga, Pero pag lumabas mo, magaling na magaling ka. May training program naman na o bakasyon, pero pasado ka lang, so pwede ka doon ka rin. So, nasa iyo na yan, di ba? Pwede ka man so, kung ano talaga gusto mo. So, bago ka pumasok, isipin mo kung gusto mong anong pasukan mo at saka anong pupuntahan mo, di ba? So,
Tama.
pag pumasok, yan lang. Yan yung advice ko, Doc.
Thank you. Thank you
Yung sa
very much.
radio.
Yeah, thank you very much. I think that's it, no? Ano? Ang sabi nito, it's great, no? Good, no? Chairman. Hi, Dr. Ara. Okay na tayo.
Parang meron na, thank you. This is the best discussion ever. Best discussion I ever heard. Masyadong, ano kung i-comment nga yung wild? Bakit may wild comment?
Dahil siguro
Ano wild?
Wild
babasahin ko
Honest
na lang.
kasi.
Wild daw yung mga chairman. It's great to hear candid talk. And the chairman are people too. Tama naman, di ba? Para kasi mas wild pa ho kayo sa mga bata, I would like to share that with you. Baka ma-shock ho yung mga young doctors sa inyo, sir, ha? But sometimes it's better to be honest and truthful, di po ba? Para at least alam natin yung hinaharap po nila. Dr. Mafi, thank you so much. Ang ganda po ng mga
Thank you.
programs sa Medical
Ang
City.
ganda ng discussion po lang, Dr.
Sobra. Ito lang po talaga sa buong Pilipinas ang nag-usap ng
Dapat
ganito.
next year, ganito ulit.
Yes, ma'am. Si Doc Albert, thank you for preaching kindness.
Thank you.
And Doc Max, thank you for preaching toughness. Kailangan din naman ho yun. Kasi somebody told me this, Doktora, kung nakabukas na po ba yung puso nyo, gusto nyo bang kindness or gusto nyo ng intelligence at galing? Napilitan ako sumagot ng intelligence at galing. So, yes, actually, lahat po kayo may tama. You all have your point of view. It's correct in different ways po. And thank you for saying that. I'm really so interested. It's the best discussion that I have heard in a really, really long time. So, Doc Matthew, Doc Albert, and Doc Max, salamat po.
Thank
And
you.
with you, the three of you po, and Doc Jean po as role models, hindi po magkakamali ang future generation na mag-train po sa ilalim ninyo. I would like to correct, Dr. Jean is a master's po in public management and a government doctor. So, sa inyo po lahat, I plan to visit Cagayan de Oro po in Cebu. Maybe with Dr. Jean, pagtapos na po itong COVID.
Oo, sana, okay na. Discussion,
Doktora, malapit lang po kayo. So, madali lang po kayo mabisita. Natatakot
Yes,
lang
come
ako.
over.
But if I do happen to win the Air Cube popper, isusot ko po yan papunta. So, Doc Max, please invite all surgeons. It's really unique po yung Air Cube popper po na ipamimigay. So, sa inyo po lahat, talagang ewan ko kung anong comments ng mga bata pag nakinig sila dito. But I'm glad po that they would know the honest truth before they start po upon their residency journey. Ano po? It's good for them to be enlightened po. And it's good for them to know that chairman also have a human side. Hindi po tayo pinapunta doon para pahirapan lang po sila. But hopefully to consider us as future colleagues po. And in the future, they will be beside us po sa clinics, sa hospital po. And we are happy to have the young ones and the forever young ones. So, hindi ba tayo yon? So, yes. So, anyone saying
Thank you.
salamat
Thank you.
po. Doc. Salamat.
very
So,
much.
thank you po. Thank you, Doc Jean, Doc Mafi, Doc Max. Salamat po. The best kayo, sir.